Welcome, everyone, and thank you for joining us for today's webinar, Fast Access for Meditech Expanse with Imprivata Mobile Device Access. I'm Miriam Lizardo, Marketing Programs Manager with Imprivata, and I'll be your host for today's session. We'll be starting the presentation in just a minute, but before that, I have a few quick housekeeping items for our audience. First, I encourage you all to take control of your audience console to make the most of this session. You can move and resize the windows you see on your screen. So for example, you may want to utilize the full screen option for the presentation window. Please make note of the icons at the bottom of the screen, as you'll want to visit several of the widgets during the presentation. Clicking on the icons will hide or show the console windows. Click on the Q&A widget to enter questions at any time during this session, and we'll leave time at the end to answer them. The resource list widget provides links to other relevant information that you may find interesting. If you experience any technical issues during the presentation, click on the yellow question mark widget. The audio for this webinar is through your computer. There is no dial-in, so be sure that your speaker is not muted. And lastly, everyone who registered for today's session will receive the recorded version of the webinar via email. With our housekeeping items out of the way, I'll turn things over to our presenter for today's session, Rachel Pickering, Product Marketing Manager here at Imprivata.
Thank you, Miriam, and thanks everybody for taking the time to join us today. Before I jump too deeply into Imprivata's solution for mobile device access and how it can streamline some of the workflows that organizations are using for the different applications like Meditech, I want to talk a little bit about why the challenges exist and kind of level set on what clinicians are experiencing, what IT administrators are struggling with, and why it's so difficult to find a solution right now. It's not news that clinicians are becoming more mobile. It's a combination of the fact that technology now enables mobility. You know, a few years ago, this wasn't something that folks could do. Now you can do anything that you need to within the palm of your hand, and the applications, the EMRs are starting to catch up with it. So you've got clinicians who are moving throughout the hospital as they care for patients. As a result, the use of these mobile devices is starting to increase. In particular, the use of enterprise-owned shared devices from manufacturers like Zebra and SpectraLink, that's starting to become really popular in care delivery in these bedside workflows. These devices have a number of benefits, but they also present some challenges. In particular, how do you unlock the full value of these devices while also ensuring security and protecting PHI? Right? There's a number of concerns that happen when the whole purpose of these devices is to allow clinicians to get up and go, but that's exactly what they can do. They can get up and go. These devices are small. They can be picked up by anybody, and so it's really important to ensure security on these. So there are a number of considerations when implementing shared devices in mobile applications that organizations need to take into account. For example, these devices facilitate increasing clinical mobility by enabling patient identity management, clinical communications, lab collections, and a number of other mobile workflows, but it's important to consider those workflows and make sure these devices and applications are usable so you'll drive adoption and realize their full potential as a valuable tool in delivery of care. So what does that mean? That means you have to make it easy for folks to be able to get to these applications, to get onto the tools that you're giving them. If it's too difficult, it's going to be an issue. Also, these devices are purpose-built for healthcare to put the power of technology in your clinician's hands at the bedside to automate these workflows that were once manual. But because they're shared devices, how can you be sure you're protecting access to PHI? How can you ensure that only authorized users have access to this specific patient health information? And because these are enterprise-owned devices, you have more control over their use, and therefore you can enable tighter security over something like an individual user device, but it's crucial in many areas of healthcare, including this, to be sure that you enable security in a seamless way that doesn't create a barrier to patient care. Obviously, anytime you are setting somebody up to have access to the EMR, to have access to their mobile applications, you're also opening the door to a lot of patient health information. So it's important that you lock down these applications at the highest level possible, similar to secure communication where you might be sharing patient information or helping to coordinate care between different folks. This is the number one reason why people are moving to these shared mobile devices, is because now that the EMRs have caught up and said, hey, we've got a tool that you can work with through the palm of your hand. You don't need to necessarily cart around these large workstations. You don't need to sit down on a laptop or a workstation that's in the patient room and be, ticking away on the keyboard, not looking up at the patient, not being able to make eye contact. You sort of put the technology as a barrier. The EMR applications have said, hey, we've got a way to make this more mobile, to make it easier to get in and out, to better focus on patient care and to have more of that face-to-face time. But again, these applications are so critical to secure that you're starting to think about stronger ways to secure them on mobile. It's not just a workstation that's, easy to manage like it once was. So the mobile devices can be used to access this PHI, so they require security measures to be put in place, something like requiring users to unlock the device, and then there should be different security layers already for each application. Management, different complexities are often required for different types of applications, whether they're managed through your Active Directory or not. You run into issues where different applications have session timeouts at different times based on whatever your security protocols are. And so this authentication is unique. It's manual. It requires username and password over and over again multiple times throughout a shift. And it starts to become more secure but less convenient for clinicians. And when we live in a world where we are counting clicks and scratching our head about what to do with clinician burnout, how to improve these workflows, how to make them more efficient, we're stuck with this conundrum where, locking the device improves security, but it requires clinicians to enter yet another password to access. And then once they're already in there, they're required to manually enter these usernames and passwords for each application. This is cumbersome. You're talking about small form factors. You're talking about tiny little screens, different complexities of passwords. They're not always your AD password. They might be different things, right? And so as a result, what you start to lead into is frustrated users who are starting to burn out, and they're not going to adopt the devices or the technology that you're giving them if it's too hard to use, right? We are still in a world where we frequently find that clinicians are going back to manually writing down information on a piece of paper and then entering it into the EMR later because it's taking too much time to get in there and do that. And that opens you up to all kinds of risk, right? So we need to make sure that the technology that we're putting in the hands of our clinicians is useful and it's accessible. Otherwise, we're going to run into issues where you've made large investments in these technologies, in these devices, and if it's not getting used, it's bad for your clinicians, it's bad for your enterprise, and really it's just a poor issue across the board. Like I said, this is an enterprise issue, but it becomes pretty startling and easy to understand if you shine a lens just simply on time loss for clinicians. Requiring manual logins to unlock the devices and then access applications results in potentially significant productivity loss, but you've got to do it. It's similar to time loss logging into desktops and workstations that OneSign solves. So for example, let's say you have 200 shared devices in your environment and users are required to enter credentials to access the device and the application, say on average 8 times per shift. If each login takes 20 seconds, that's about 2.5 minutes spent logging in per device per shift. If you expand that over the course of one day with 3 shifts, that turns into about 8 minutes spent logging in per device. If you take a step further back and you look at all 200 devices in use, that's 1,600 minutes or 27 hours per day that the clinical staff is spending entering credentials just on mobile devices. When you then compound this time over the course of a year, you can see that it adds up to more than 9,600 total hours. And this productivity loss comes as a significant cost. If you just throw in average salaries across the country, the value of this lost productivity could exceed $300,000 annually. And that's just for 200 devices based on conservative estimates of uses. If your organization has stricter lockout sessions, if it's got an incredible amount of applications, some departments use a lot more applications than others, this is going to start to compound really quickly. And as you take a step back and think about what you could do with this extra time, whether it's better allocation of staff resources, more time spent with patients, better quality care. I mean, you guys know this better than I do. There's an incredible amount of things that your organization could do with 9,600 hours a year, right? So when you think about that, it starts to become really startling. That's where Imprivata Mobile Device Access comes in. Imprivata has worked to create a solution that extends some of the same security and workflow benefits that we're able to offer on traditional workstations now to these handheld computers, these mobile devices. Imprivata Mobile Device Access is healthcare's only mobile authentication solution that enables fast access into these devices and into all of the unique applications that are used for care delivery. It delivers the same fast, familiar authentication workflows that clinicians are already familiar with on their workstations to these mobile devices so that you can unlock the full potential of mobility. You can enable your clinicians to move about throughout their day to access all of this neat new technology that medical device vendors, that EMRs, that secure communications providers are starting to deliver on these devices. And they're really neat devices, right? You can do pretty much anything you need to between barcode scanning and all of that now in the palm of your hand, but Imprivata enables you to do it securely and efficiently. The workflow is also incredibly simple and easy to pick up for your clinicians. First, on the outside, Imprivata Mobile Device Access enables you to lock the device, so improving security for that specific device on the most outer level. And then it enables fast access with the tap of a badge, so it's built right into the native NFC reader on these Android devices so that you can use the same workflow you're already using in other areas, boom, right on the back of the device. From there, Imprivata enables users to single sign on into each one of these applications. So your EMR applications, getting in and out of Meditech, getting in and out of your secure communications, whatever it might be, automatically your single sign-on into these applications to remove the need for the manual entry on these tiny little form factors, ultimately resulting in workflow efficiency, increased adoption of these devices and the new applications, and happy users overall. So by enabling fast, secure access to the devices and the applications, you're able to experience benefits that spread across the enterprise, whether it's improving efficiency for clinicians and saving time, more focus on patient care, that face-to-face true interaction that is what clinicians are looking to do. But you're also able to improve security and auditing. You're able to drive adoption of these devices and applications, so you're investing in this new technology that you're able to take advantage of. And you're also able to do things like better inventory management, which I can get into in a little bit more. But these benefits ripple across the entire organization. And now I want to spend a little bit of time talking about some of the key features that we've developed that are specifically tailored toward the needs of clinicians who are accessing these devices, right? Getting in and out of your EMR, getting in and out of Meditech over and over again through each patient as you're passing these devices between different clinicians. It's really important to have the security, but also the key workflows that they're looking to do with these devices need to be taken into account. So from an IT administrator standpoint, one of the most important things is device access management, right? Adding security to the devices on that outer level. Right now, what's happening is a lot of these devices are not designed for that shared use model that you guys are probably doing throughout your nursing teams and other staff. So what you either have to do is not require authentication on the outside at all, which is a huge issue with PHI exposure, or you're probably doing something like locking it out with a PIN that's shared between users. And so sure, that's a little bit better, but usually these pins are simple, 1, 2, 3, 4, 0, 0, 0, 0. So not only are they, not really a strong security barrier, but you don't have any visibility into who's accessing these devices. It's easy to get in there and access the device on the outer level, but if the last clinician forgot to log out of their Meditech instance, now you've got somebody else who gets in there. They're going to be charting under the wrong name, which is an administrative nightmare. We're able to improve that management. We're able to put this layer of security on the outside, but also tie it to the specific clinicians who are getting in there and accessing the device so that you can have unique user credentials to get onto these devices, so that you can enforce complex passwords so that it's not something that somebody can pick up and easily guess, and you've got this simplified management that is already built into the core infrastructure that you have for your other access management. You're replacing this repetitive manual password entry with a badge tap to gain access to these devices. And that's also going to allow you to implement shorter timeout periods to further increase that device security. And then to further recoup the lost productivity, we're able to enable single sign-on into the mobile applications like your Meditech, like your secure communications, these critical applications that clinicians need to deliver bedside care that directly link to PHI. You want to make sure you've got the utmost security on these applications. With Imprivata MDA, you're able to streamline the workflow and give providers more time to spend on patient care by implementing a similar experience that they're already used to on their desktops, removing the need to manually enter passwords into each application. This is, again, especially beneficial when you're considering that small form factor on these devices. The simplified access also removes a potential barrier to adoption, allowing organizations to, again, unlock the full potential of the shared devices and the applications as valuable tools in bringing technology to the bedside to help improve patient care. And then I briefly touched upon this a minute ago, but because these mobile devices are shared by clinical staff, there's a greater risk of a provider accidentally accessing and using devices while logging in as a different user. This increases the risk of PHI exposure as well as medical errors and data inaccuracies. Imprivata Mobile Device Access addresses this by enabling secure fast user switching with the same simple badge tap used to unlock the device. Providers can instantly close their session and log off. This safeguards patient data, greatly reduces the risk of clinicians accessing applications under an incorrect ID, and leaves the device in the proper state for the next user. And if a user forgets to lock their session or puts a phone down and it's timed out and still logged in on somebody else, but maybe that device is locked, a second user can simply tap their proximity badge that'll instantly log the first user out and log the second user in. So now you're quickly accessing all of the applications that you need to get to under the right user without any issues. And since you're able to also require unique credentials to access these devices, Imprivata Mobile Device Access can record all device access events in our centralized database within your virtual or physical appliance. The appliance provides out-of-the-box reports that give administrators full visibility into access of these mobile devices, which enables you to rapidly respond to audit inquiries, to get better understanding of who's using which devices to help with things like inventory management and loss prevention. You can understand whether certain departments or groups of clinicians are accessing devices more often than others. You can better decide where you need to build out resources and maybe pull back or adjust. And it streamlines reporting for IT administrators and gives organizations better visibility into how, when, and where clinicians access and interact with patient health information on these devices. Finally, Imprivata Mobile Device Access integrates seamlessly with Imprivata OneSign, which many of you out there might already have or are looking at. It's our enterprise single sign-on and virtual desktop access platform. So we're able to leverage the same appliances, administrative console, and other core infrastructure that you already have in place on this mobile device access solution. So for clinical staff, this ensures a fast, familiar, and consistent authentication workflow experience across workstations, virtual desktops, and now mobile devices. This integration also allows IT administrators to set user authentication policies for all systems and workflows from a single centralized platform, which improves compliance reporting, reduces total cost of ownership, and minimizes the IT resources required to administer and manage authentication workflows.
Okay, great. Thanks so much, Rachel. I do want to let our audience know that if you would like to enter any questions, you can do that into the Q&A console there in your window. So I'll give you all a moment just to do that, and we'll address those. Okay, looks like we do have a couple coming in. So Rachel, the first one here is, can Imprivata Mobile Device Access be deployed with our mobile device management solution?
Yeah, absolutely. We work in tandem with, or on top of the MDM solutions. We work with most of the leading solutions out there, and we're able to work within the policies you set or beside them.
Okay, great. So that means there is one that came in around Mobile Iron, so I'm assuming that is one of these solutions that...
Yes, we're integrated with them as well.
Okay, excellent. Also, another question here, can you enforce two-factor authentication on a mobile device?
We can, yes. We work within, the same confines of policies that you already have set up within your Imprivata appliance. And so there are workflows that you can enforce for this, or if there are certain applications that require it, we certainly don't get in the way of that.
Okay, great. Next question is, does mobile device access require any additional licenses above beyond a user-based OneSign license?
It does, yes. So this is a device-based license. It's sort of a connector fee for each of the devices that you want to be able to tap into in your environment. So the users who have OneSign are able to then tap onto these devices once you unlock that capability.
Great. Then we address the Mobile Iron question. And then where do they physically tap the badge? Is it on the phone itself?
It is, yes. So we integrate with Samsung devices, with Zebra, with a couple other folks as well. And it's something where it's natively built into Android devices today. So all Android devices are built with an NFC chip, and it's right in the back of the phone within the actual phone hardware, and so you're able to just tap in an NFC badge right on the back of those phones to get access to that chip. I will say Android natively has NFC, so if your badges don't operate on that frequency, we do have some workarounds to enable you, whether it's with a sticker or some other workflows that we can do there. But natively, Android does work off NFC.
Okay, great. All right, looks like we have, this might be the last one I see on the list. So do you have plans to support iOS in the future?
Yep, so like I said, we are only on Android today. We are looking into being able to support iOS in the future. We don't have any specific timelines on that yet, though.
Okay. All right, looks like that's all the questions that we have for today. So I do want to thank everyone for joining us. We will be sending out the recorded version of this webinar in the next day or so just be on the lookout for that. The email will be coming from me, Miriam Lizardo, and if you have additional questions, don't hesitate to respond directly to that email as you see it. So thanks again, and hope you all have a great rest of the day.